drugs, injections, surgery, and adjunct treatments for lower back pain. When we talk about managing back pain with medicine, we have our pyramid. At the base of this pyramid, we have our paracetamol, which is often the first medication that the GP will offer you. It is a simple painkiller which has few side effects if taken correctly and therefore can be used for long term. It is more effective with regular dosing as advised on the packet rather than waiting for the pain to set in. It can be provided over the counter or it may be prescribed to you by your doctor. We also have our non-steroidal anti-inflammatory drug creams. So this is your Voltarol and your Ibuleave, which you apply directly to the skin. And you can use these alongside paracetamol or instead of paracetamol. And similar to paracetamol, you can get these over the counter or they may be prescribed to you, and you can use them for long term use. We also have our capsaicin creams, which are based on chili peppers, and they block pain messages to the brain. Above this, we have our anti inflammatory drugs. So these are your non steroidal anti inflammatory drugs that you can get prescribed to you or over the counter. These help to calm down any inflammation in the joint, which can help manage the pain. They can be used with paracetamol if paracetamol alone isn't sufficient in reducing your pain, or it can be used instead of paracetamol if paracetamol is completely ineffective. However, they can cause some side effects such as heartburn, nausea, skin rash, and cause stomach ulcers. So, occasionally, you may get given medications such as omeprazole or lansoprazole to help protect that stomach lining. They also do increase the risk of heart attacks or strokes, so therefore you may need to have a conversation with your doctor beforehand if you've have heart problems or have previously had a stroke or any circulatory problems. You should only take one form of these drugs at one time. So for example, if you're on aspirin, you shouldn't be taking additional ones alongside. We then have our opioids. So these are your stronger painkillers that are sometimes provided if greater pain relief is required. These are only normally given out if the other methods of pain relief have not worked, as these can lead to dependency and drug addiction, and their side effects can include nausea, vomiting, constipation, drowsiness, and dizziness. For example, we have the form that you can get over the counter, which is cocodamol, which is codeine combined with paracetamol. And then you have your other opioid options, which are normally only prescribed to people from our GP. At the top of this pyramid, we have our corticosteroid injections. And these are our anti inflammatory injections that are delivered directly to a specific joint. These tend to be quite short term. They may settle down pain when we're in a flare up, and are mainly normally only used with people who are suffering with either moderate to severe pain. And we can only have these only a certain amount of times per year. As you can see around the pyramid, we have our arrow going up and our arrow going down. This shows that you can go up that pyramid to help manage your pain, but also once it's managed, you can come back down and use the other methods that are lower down in this pyramid as well. Pain does fluctuate, so it's figuring out what is best for you at that time. Adjunct treatments. So we have our acupuncture. There is some reasonable evidence to support using acupuncture in lower back pain. It may provide some short term relief in pain, and it seemed to relieve and alter the pain messages that are being sent to the brain, and it can help in releasing those endorphins as well. We also have our manual therapies, such as massage, mobilizations, and manipulations. They tend to be mainly short term relief, but some people do find them effective. We also have our TENS machine, and this is a small electronic device which sends electrical impulses to the nerve endings via the pads that we place on our skin. It produces a tingling sensation, which helps to block those pain messages being sent to the brain. Can be bought in places like chemists, and some people may find it effective, but it's not effective for everyone. These should not be the TENS machine should not be used if you do have a pacemaker. Surgery and injections for lower back pain. Overall, lower back pain and sciatica, there are comparable results with exercise in the long term. However, there are various injections that are available and can be effective usually in the short term, and that gives you that window in calming down that irritation to be able to do your exercises to get the benefit in the long term if your pain is very high. Surgery wise, we do have good success in treating sciatica, but there's not necessarily great results for general back pain. So it's figuring out what suits you and coming to a decision with the help of your GP and a physiotherapist if required.